Hello, I'm Penny Gibbs, and today my guest is Simon Runnett, who works at the clinical commissioning groups in Staffordshire and Stoke-on-Trent. And today we're talking about how Simon's changed his roles to return back to nursing to support the coronavirus outbreak. Simon joins me now. How are you, Simon?
Hi Penny, I'm very well, thank you very much. I'm just working at the testing centre as we speak.
And how is homeschooling going with your daughter?
It's going okay at the moment, to be fair. I mean, she's incredibly resilient. She's a fantastic young lady, and she's absolutely surprised me absorbing all of this. And I must give a massive applaud to all mums and dads at the moment homeschooling, because I know how difficult it can be.
I'm really interested to talk about your career with the NHS. I know you've got a nursing profession, which we'll touch on in a few moments, but that wasn't the job that you were doing before you were redeployed, was it? Can you just tell me a bit about what you were doing for the clinical commissioning groups?
Sure. So my actual job title, I suppose, is commissioning manager, and I work for the southwest locality. So that's for the bottom end of Staffordshire, basically. My main role is purchasing the services for the rest of the NHS, whether it's private or NHS services. And we make sure we get the best outcomes for our patients in Staffordshire. So that was my previous role before coming to the testing centre.
So you were redeployed because of your nursing profession, and am I right in saying you've done 25 years as a nurse for the NHS?
Yes, my 25th anniversary was March the 6th this year. So my profession is a registered sick children's nurse. So prior to coming into the CCG as a commissioning manager, I was the team leader over the children's community nursing team in North Staffordshire, which looked after complex, acutely unwell and palliative children who had a palliative diagnosis. Prior to that, quite an extensive journey through the NHS. And then prior to that, I was in the Army as a Royal Engineer and medic in the Army.
So can I just pick up on your career on the front line as a nurse? What did your role entail?
So my previous employer was Midlands Partnership Foundation Trust, and prior to that it was Staffordshire Stoke-on-Trent Partnership Trust. And my original role when I joined that organisation was as a community nurse, and I and a few of us set up a team called Hospital at Home, which was to avoid hospital admission for acutely unwell children. As time went by, I was given the opportunity to team lead all of the service, which included not just the acutely unwell children, but children with complex conditions, physical or cognitive, and children who had a palliative diagnosis. So we basically supported children and their families to live the best life possible, whilst also supporting children during those last days of life.
Wow, what a career, and 25 years under your belt. I hope you celebrated well.
I actually kept it under the radar, if I'm honest.
No!
I know. I was kind of. It was actually quite strange. I came into the office one morning, and I just looked at the calendar for some reason, as you do, looking at meetings, etc. And I just recognised the year, and I went, "Oh my God, it's 25 years next week." If I'm honest, I got a little bit teary. And when I look back and everything, and I spoke to my manager, Craig, at the time, and he just looked surprised and he shook my hand, and I think it's the NHS has served me very, very well. It's been a lifelong career for me, and it will be for the next 10 to 15 years, I should imagine.
That leads me nicely into talking about you being redeployed to help at the testing centre during the COVID outbreak. Tell me what your initial kind of feelings and thoughts were when this was approached. I mean, was this something that you volunteered to do, or were you asked to do? How did it come about?
The CCG wanted to support the system and the wider partners in responding to the COVID pandemic. We received notification that the required staff to come and work and set up the testing centres and support the testing centres in the long term. So I answered the call straight away. I was more than happy to come to work in the testing centres. I think operational matters has always been my forte. But I knew at the start of it, I knew what a difference that this service could make, not just to people's lives, but to the NHS and the wider system, to give the NHS that breathing space, and ultimately this will save lives. So I understood the reality of it, and I was quick to jump to it. It did not worry me at all. I think most nurses, if you ask them, they want to care, they want to look after people, and they will put themselves on the front line if needed.
Tell me a bit about actually what the role involves at the testing centre.
So the testing centre obviously is a pre-booked system at the moment, and my role initially was working with my colleague Yaz and Nigel down at Burton. We initially set the site up, and the process is we will either be swabbing or buddying. The majority of the time I have actually been swabbing people coming into the actual test centre, and talking through them, put them at ease, talking through the process with them, when they will expect the results, and then doing the back office stuff of making sure the samples are in the pathology lab on time, and then basically standing down the site. So every single day you come in, you have to set the site up, do the tests throughout the day, and then you have to stand down the site as well. It's a really unique way of working. Today, at the moment as I speak, I'm currently the site manager for both sites, the Burton and the Stoke site as well, which has been a unique morning for me. And meeting new people, new processes up at Stoke. But ultimately, it's going very, very well, and it's very well received by the members of the public. And I've also got to say, a big thank you to Burton and Stoke, the community arms of those football grounds, but equally the staff that are supporting me and supporting the CCG. We've got staff from every part of the NHS. We have dental staff with us. We have admin staff with us. We have CCG staff with us. We have nurses with us. So it's been a real massive call to arms. And if I could say something to the members of the public, I absolutely applaud them, because to drive up to the test centre and see the nurses fully kitted out in PPE, we can visibly see that people are very, very sort of, I won't say scared, but slightly traumatised. I think it really brings home to them that, that's actually what the reality is at the moment. So we try to give them as much reassurance as possible. We try to keep it as light as possible, but whilst getting the process done.
So how did it feel returning back to a nursing role in this current environment?
Returning to nursing, it didn't really faze me, if I'm honest. I think there's certain things, after doing 25 years and my previous career in the forces, there's certain things you never forget. And, this is a process. We have to remember that this is a process. And the process is quite rigid about how we do the testing. If I'm honest, I was a bit nervous, because I was 18 months since the last time I actually did any face-to-face or kind of hands-on nursing. The physical aspect of the actual swabbing is relatively simple, and I brushed up, and I wrote the standard operating procedures for the test sites as well. So it was quite easy for me to adapt and such like. My best skills I've always felt is around operational and team leadership, being able to support staff and work through problems to get the processes as lean as possible.
Would you ever consider returning to nursing more permanently? So once the testing sites have maybe reduced slightly and you're asked to go back to your commissioning role at the CCG, is there anything that would make you want to carry on doing that nursing frontline role?
I think looking to the future, I think my career hopefully will remain in the CCG. There was particular reasons why I changed my career path prior to this coming into the CCG. It was a few various reasons. I'd done frontline services, mostly acute and trauma and theatres, and acute admissions for 25 years. And prior to that, I was as a combat medical technician in the forces. And it was certain life events. I think it was approaching 50. My daughter was recently diagnosed with autism, and I just felt it when the time was right. And I wanted to. I think most nurses understand and managers understand. There's different ways of affecting care or changing care, and I felt I'd done as much as I possibly could on the front line, and I wanted to use all my experience, all the knowledge and expertise, and shaping care in a different way. And I felt that way, the way to do that was to work for the CCG. And I think as I've come into the CCG, I think I've totally understood how useful I can be to the CCG, to bring all that experience and knowledge and the clinical aspects of so what factor for the patient, but in particular to children's services, because I'm a registered sick children's nurse, and to just you basically use all that experience and knowledge and expertise.
Could you please just remind people who are listening what the testing centres are there for, and actually how they find out whether they meet the criteria for a test?
So the testing centres are here just quite primarily to test people to ascertain if they are positive with the COVID-19 virus or negative, so they don't have the COVID-19 virus. The actual criteria is published on the government website, which is gov.uk/coronavirus. And if people want to access that website, they can check the criteria, and there's multiple links in there where they can access the test centres and book themselves on a test.
Thank you so much for your time today with us, Simon. Before you do go, if I can just ask you one last question. For people that are listening today, what one piece of advice or information would you want them to share and remember during this pandemic?
If I'm honest, I think talk to each other more. Stay in contact with people. I think we're understanding now what life is about. I think a lot of what we've had to restrict is basically stripping away our busy lives, and I think it's made us actually realise what is truly important in life, and that is family.
Thank you so much, Simon, for your time.
Okay, thank you, Penny. Take care.